Hi, everyone, and welcome back to the show. Today, I've got with me Anthony Roscoe. He's the Director of Enterprise Data Governance at Highmark Health. He's based out of Pittsburgh, Pennsylvania. Also, really interestingly, Anthony, I picked up on your LinkedIn profile that you've got a bunch of black belts, one in Six Sigma and also a fourth degree black belt in judo. So I'm guessing we shouldn't mess with you either at work or in a fight. But anyway, Anthony, welcome to the show. Thanks for coming along.
Thank you, Jason. It's a pleasure to be here.
Cool. So we want to talk about so your role is in the kind of enterprise data governance space. We want to talk about the convergence of analytics and data and the governance that wraps around that, with a lens on healthcare. You work at the organization called Highmark Health, as I mentioned. It'd be good to hear a bit more about those guys and you. But yeah, the convergence of analytics and data. Should we get kicked off though with a little bit about you? And the business that you work for?
Absolutely. So I've been working in the healthcare field for just about 26 years or so. Okay. And it's been a wild ride, I have to say. Lots of changes over that time. Here in the States, we had in the 1990s, HIPAA was a new thing, which I would call the beginning of true governance in healthcare. Obviously enforced by the government, not by the local institutions, as we like to see governance happen more organically from the institutions and not being forced upon folks. But regardless of that, it's been an interesting ride here. So I have a background in health information management and legal aspects of healthcare, and then a large number of years spent doing IT specific work, both in the data space and application space and architecture space for building applications. Right. And then about 3 years ago came into this governance role, which I think is a really nice natural fit for myself. It's again, looking at healthcare and where things are going, both in the US and across the globe, and looking at data and how it impacts what we're doing is really quite interesting. And as you mentioned, we talk about analytics and every industry being so important these days, everything from machine learning and other forms of artificial intelligence, but none of that works without data. And so we have to be sure that we're managing our data correctly and treating it as the strategic asset that it truly is.
Yeah, well, you're preaching to the converted there on that point. So that's great to hear. And the Highmark Health, what does the organization focus on? Is it sort of a niche that you're in, or more broad across healthcare?
Sure, it's rather broad. We started as a couple different organizations, a hospital system that was based here in Pittsburgh and actually served the wounded from our Civil War back in the 1800s, right. As well as a Blue Cross and Blue Shield Association licensee health insurance plan based out of Western Pennsylvania that then affiliated or merged with other blue plans across New York, Pennsylvania, Delaware, and West Virginia, bringing those together with a couple other subsidiaries in dental insurance and stop loss insurance. And we have this integrated delivery and financing system that is by revenue the second largest in the US.
Okay. Wow. So both the delivery of healthcare and the insurance side of funding.
Yes.
Cool. Great. Well, thank you for coming on the show and introducing your background and the organization you're in. I think it's interesting hearing you talk about sort of data, the importance of data in that ecosystem, that part of the business. Also, the light that's on healthcare just generally across the globe right now with COVID, the pandemic. But I suppose more broadly, the state of healthcare in the US, or the kind of how it manifests itself in the US. I know it's quite different from my experience in the UK with the NHS that we have over here. Very proud to have that. How does it kind of how does data play a part in the kind of the healthcare system, either specifically for you guys or more broadly? Where is that kind of pockets of opportunity, do you think?
Well, I think that you'd be hard pressed to find someone that would say that there aren't problems in any healthcare system. whether it's the NHS or our system here in the US. We struggle here in the US with a lot of different opinions on how best to meet the needs of our population and making sure that there's access. I mean, we have people that live a block from a hospital that can't use that hospital for their needs, which would be unheard of potentially in the UK, but here it is a reality for some folks. So when we look at some of the challenges that we face, both through access or the delivery of care or the financing of care, we have to recognize that we have some baggage from the history of how things have rolled out and how things have changed, and some missteps here and there. But largely, the healthcare organization of today is utilizing data to look at patterns of population health, value-driven care, and what the best ways to reach the population, either through wellness programs sponsored by employers, which a large portion of our insurance and access to healthcare is done through employer-based benefits. And so as we look at these different systems and we analyze what are the best ways to deliver and finance the care, it's all driven by data. For instance, my organization over the past several years looked into our communities where our members were living, where people were seeking care, and the travel time that they had to actually get to a location that would meet their needs. And we ended up building several health pavilions and brand new hospitals. And there aren't a lot of places in the US where people are talking about building new hospitals, brick and mortar facilities. And yet we were doing that. Followed up by a longer term strategy where we recognize that sometimes it doesn't make sense to build a hospital if you're not going to be able to staff it. So how do you appropriately meet people where they are in rural communities? And investing in such things like telemedicine, not just from and it was very beneficial from the COVID perspective to have begun investing in that, but tele-ICU. When you look at a rural community and you recognize that having multiple ICU specialists in that area is not a realistic aspect of the population, the availability of those individuals, and the ability to pay them. So you look to partner with organizations that offer that type of remote ICU specialist care for a hospital, so they can actually have an ICU without necessarily having that ICU specialist on premise.
Yeah. So I can see the way sort of data plays a part in identifying geographically where to base physical buildings and hospitals, how you can look at that kind of supply and demand of different types of care, and there's nuance, isn't there, with different needs in different parts of the country, based on health, but also based on, as you say, the ability to access the kind of care that's needed. And is that has data always been at the center of that in your organization? Has that changed over time? Is it kind of matured in terms of of how it plays its part and where?
I think that the focus on data has taken an interesting journey to prominence in my organization. For the longest time, I think it was almost taken for granted, and I say that not to be critical of anyone, but we just had all of this information and we had it at our beck and call, but it was siloed at times, and the usage was siloed across the different parts of the organization, and looking at what they actually needed and what they could use it for. And over the past 3 years, we've been looking at opportunities to truly bring an enterprise view as we've made these acquisitions and affiliations, et cetera, bringing the hospital system in, and not looking at it from that siloed perspective where you have the clinical data in the electronic medical record, and you have our claims and all of our membership information in our insurance platform. How do you bring that together? And we started working on an enterprise data lake, and that's when we were saying things like, hey, we have a governance program that's pretty much focused on risk and sharing and usage questions, but we don't have a lot of focus on data ownership, and when we start bringing this data together, how we evaluate use just within our own walls.
Right.
We had a good process for evaluating, do we want to work with a vendor? Do we want to send this data out? How do we send it out so that it's secure and safe and protecting our members and patients? But bringing it together and looking at it in a comprehensive view was, again, not something that was as easy as you would think it would be. Actually, most people in our field would say, oh, that's absolutely not easy. But the challenges of scalability and then just breaking down those silos were very realistic. And I think that in the past 2 years, we have matured in a way to accept that we need an enterprise data strategy, more so than what we have done in the past, and really looking forward to supporting some pretty big picture business strategies, where we're trying to say that we want to make our members and patients and clinicians have a remarkable experience. Because anytime you go to the doctor, no matter where you're going, unless it's for perhaps your annual physical, which can, even then, because I just did mine and I had a little anxiety about, the COVID-19 pounds that we all gained over the span of this past year and a half. But as we look at those interactions, they're prone to build anxiety. How do we make that a better experience? And that's partly driven by data, and keeping the clinician from having to search through your record or to have them peppering you with questions like you're on the stand at a trial. How do we make that experience be more fluid and almost normal conversational types of interactions? And believe it or not, as sterile and as computer based as that may be, it really can be driven by data. And so that's where we're aiming for right now.
Yeah, I like the idea that that data plays a part and can play a part in helping to build a better picture of the individual that is accessing your services. And that service, as you say, can be anxiety filled. Certainly it can be quite a negative and sad and difficult experience, right? And you've got to deal with that with humanity and empathy. But knowing the individual is a really good first step, because that kind of emotional feeling of interacting with a healthcare professional that doesn't know you, doesn't have any background, doesn't understand your nuance, and is treating you like the next one in through the door, it isn't great. In the same way, and if I compare it to kind of retail, you're either a faceless customer on a website, or you feel like you're being known and looked after and nurtured and given the support and help that you need. So I like that the strategy you talk about there is focused very much on the kind of patient interaction customer experience in a way.
And I'll call something out too, because it's not just on the customer. I think there's this total health experience that occurs, and it's very real for the clinician as well. Because if we take the retail situation, you can see that, like, you don't know your customer there. You don't have the detail of their past purchases or behaviors necessarily. Granted, on a website you probably do, so they're getting peppered with ads based on all of this information being driven there today. But if you think about either the salesperson or the clinician, they don't have all that background. And they could do a lot of research, but then they're spending time doing that instead of attending to other patients or other customers. So I think we're aiming to enhance the clinician's experience in addition to the patient and member experience. And I think bringing all of that together really just makes everything better.
Yeah, awesome. And I guess this sort of leads us quite nicely, onto the need for governance, the need for data management, the need for controls, guardrails. You mentioned ownership at sort of one end, and then the sort of insight, analytics, data products, almost value and outcomes at the other end, and the necessary sort of requirement really to converge those two things. So what sort of goes into the conversation that you're having about how you converge the use of and the exploitation of data and the capture, management, governance of data?
So first of all, I think there's a real balance between speed and decision making and decision rights. For instance, as an organization, we have all of this data, and we are expected to be custodians and good keepers of it. Again, whether that be by regulation or even, at the basis of the Hippocratic Oath for healthcare, do no harm. Why have, if we have this data, are we using it in the appropriate ways to benefit our members and our patients? And it's really important, and we take that to heart. I mean, we base our decisions foundationally upon regulations and standards and policies that are in place. But we are also looking at it from an ethical perspective and saying, just because I can do something, should I do it?
Yeah.
And does it match the values of our organization? And I think that, if you talk to any member of the Blue Cross and Blue Shield Association, they will say there is definitely a culture that pervades all of the licensees around this. I think that, again, with the hospital systems that are now part of our organization, there was a culture there as well. And blending that together, we approach what we're doing in a way that says, okay, if we're going to create this engine to learn about the behaviors of our members and patients, how do we best ensure that we have a broad data set that's representative, that we are eliminating bias and treating that well? And again, just at the heart of all of the discussions, bringing data sets together, should we do that just because we can? And those can be very difficult conversations. They can be rather challenging in the aspects of someone saying, well, this data set's publicly available. Why should it matter that I bring it in and start merging it with other data that we already have? And there can be, very pure, clean reasons to do that wouldn't make anyone raise an eyebrow. But, there are other scenarios that I can think of, not that I know these aren't things that are happening, but I can think of that would make me very concerned, both as a consumer, but also as someone charged with, running this program and, again, making sure we're doing the right things with our data.
Yeah, those controls, those guardrails are important, I guess, to make sure that not only you're doing the right thing, but that it's done in a way that continues to kind of ensure it doesn't sort of, you don't lose control over it, and it doesn't, get out of control, and that the focus is always on the thing that you mentioned before about the experience of the clinician, of the members, of the patient. Are there certain topics that are more important, do you think, in terms of that kind of idea of managing and governing data in a positive way to drive benefit? Are there sort of some certain areas within the kind of overarching framework of data governance that are most important to you?
I think right now there's a big shift as we recognize the impact on health that social determinants have. And when we start talking about that data set, or expanding that data set, or even asking more questions around socioeconomic status, and linking that to both treatment patterns and outcomes and other disease patterns, we start to recognize that, again, you want to take extra care. You want to be absolutely aware of what you're doing and how you're doing it. Because if you start asking your members to list race or ethnicity more often, or you're trying to consume that because you're looking to do good with it, it can be perceived that it's not the appropriate use. And so looking at that and creating policies and standards around how you treat that, and then treat that data, and then also, just because you have that data, not everybody gets to use it. Everybody wants to use it. I can almost guarantee you that. And they say, well, it's a corporate asset. Why can't we use it? Well, because we have these underlying standards. We have these underlying ethical codes that we recognize we need to bring to bear when we make these decisions, when we approach using the data. And it puts it into stark contrast about I know a lot of industries and a lot of areas talk about data democratization and self-service analytics. And the speed that you gain from those and the agility that you gain from those can be rather impressive and lead to great innovation. And by no means do we want to stifle innovation, but at the same time, it doesn't lend itself unless you have that good culture and that ethical basis in your practices as an organization to say, well, we've given everyone access, and we're not watching or we're not controlling. Yeah. And so you have to find that balance, because I don't believe any organization intentionally hires a bad actor, but that happens. And I think that our organization is very focused on these positive outcomes and really changing. We want to create remarkable experiences. And I can tell you the remarkable experience of hearing that someone did something poor with your data is not the type that we want to have. And so it's part of our culture to look at it in terms of, how am I helping?
Yeah. How do you go about setting those guardrails then? Because I can see, people talk about data culture, and actually this is bigger than data culture. The ethical and right use of data, and doing the right thing is a business culture in its own right. And so there's sort of like a cultural thing that you mentioned, but are there practical things, practical guardrails you put in place to allow the organization to flourish and get the value it that exists within the data, but maintains the right level of control and guardrails to satisfy both sides of that coin?
Well, when we look at our decision making and the processes that we have, we look at it in terms of diversity of the different areas that are represented when we have these discussions.
Right.
And again, our program around risk management and sharing has been around since 2016. And over time, it's really evolved. And we try to make it a reflection of the executive sponsorship team, which we call our core council for data governance. Those are leading executives across the organization. Most of them have a C in their title. So they're coming at this from that highest level, but the decisional body that they empower has representatives from a wide range of legal, privacy, security, architecture, data management, in business areas that come to the table and have these conversations around the usage. And so when we start talking about having a new standard, let's say, and we're actively looking at expanding our conversation around when we use social determinants of health in our analysis, how we go about doing that is really embedded with doing outreach from my team's perspective, because we could just draft up a policy or a standard and say, this is where we're going to go. And we just take it to the committee or to our executives. But what we're doing is we're reaching out to different parts of the organization to get their input on this, to say, you work with this data, or you work with people, not just people who are impacted by a socioeconomic status, or that they live in a food desert, or they live in a rural community that doesn't have direct access to certain providers. When we look at it in those terms, we engage those people in the conversation and start to get that diversity of opinion as well. And of course, we're looking at the models that are placed out there by other organizations that are leading in this way, and craft it. And then we take it to our decisional groups to say, we'd like to accept this as a new standard. And then honestly, the real work begins, because you have to socialize that and get the culture to merge in and have that become part of the recipes for how people are interacting with data.
Yeah. I do really love that the kind of all of the discussion we're having, or you're talking there about guardrails, is actually about the right people, the right brains, the right lenses on the discussion, bringing diversity of thought, to make sure that you're putting in place something that can be received by people. It's not kind of, as you say, land a policy on people and say, look, that's it, and you're the police. It's much more of a collaborative effort. Get the people who have the right sets of opinion, from privacy through to architecture and beyond, and then set that as a standard, get it agreed. And then, as you say, the difficult work the hard work is rolling it out and making it stick, and making sure you've got the right controls in place to make sure those guardrails stay in place. But it's about people, is sort of what I'm hearing from you.
It always is. I mean, it truly comes down to that. One of my associates, their signature on their email says, "Remember that every data point has a person behind it," and that we live and breathe that every day.
Yeah. How do you kind of avoid stifling? You mentioned it before, actually, stifling innovation, because data governance can, it doesn't feel like the way you talk about it and the culture you've got there is quite, it sort of has the potential, the risk of this, but it can stifle innovation if it's all about control. It's all about very careful. We want to tread lightly here. We can only give very specific people very specific access. It's very locked down. It's very contained because of either worry, concern about privacy, or what the regulator would say, or so that you can see why people err on the side of lock it up. But equally, when you do that, you can stifle pace, innovation, and value. How do you balance those two things?
I think it comes down to my base definition of what data governance is. If I'm going to say it in the most simplest terms, it's defining the right thing to do. And so that's not saying what not to do. It's defining the right way. So it's an enabling function. I enable these teams to innovate. And so when we see the issues with a slowdown or blockages, we start having a conversation about, how do we deal with that blockage? How do we get to yes? Not necessarily why is there a no standing here? And sometimes it's a bright line, and we can just say, no, we're drawing this line. There is no wiggle room, whether this is by precedent or executive decree. This shall not happen. But the vast majority of our conversations are, well, perhaps you haven't thought about X. How do we deal with X? And it's sometimes inching forward, but the momentum doesn't cease. And I think that's the real difference for us, is that we see our practice as an enabler, not as that gatekeeper necessarily.
Yeah, that's great. And as you say, if you treat that conversation as how do we say why not yes, I think is a nice way to think of it. And I often talk actually about data governance needing to be context aware. And yes, you've sort of said there about sometimes it's just a no. If we do this, we go to prison, we get a fine, we can't do it, we've got to lock it down, we've got to control it. But in some instances, we need to allow broader, flexible access to data to certain people in certain situations to allow them to do their jobs. I think of a sort of data science function. They need less control in some way, certainly freedom within some guardrails to try new data sets, bring in some different things they haven't done before, try some new tooling, spin up some databases, which if all of that stuff is locked down, they just can't do their job. So the context that the data is being used is important, and then aligning your sort of policies and stuff to that context, I think, helps that innovation. Have you found that sort of a helpful way of thinking about it?
It absolutely is. And just in that actual vein, not necessarily directly related to this practice of data science, but because we joined with an academic hospital system, we have folks doing research that are looking to publish, and they're using NIH funding, National Institutes of Health funding in the US here, or other types of funding that require them to follow certain rules from our federal government around using an institutional review board, which I call data governance adjacent. It's not quite data governance, but it provides that ethical oversight and some very necessary gatekeeping duties for folks that want to publish findings from data, right? And again, data is the key here. It's driving what occurs. Well, when we bring together that academic function of doing research along with an organization that recognizes its data is a strategic asset and we have a governance program, what do you do? Our typical data governance committee might not be able to address the very specific nuances that occur in a research request that, for instance, is based on clinical data from our electronic health record and passes the muster from HIPAA and the IRB to be an approved research topic, and the research can proceed, but then also wants to use, for instance, claims data from our insurance side of the business that might have more proprietary based information on how we create a product there. And so when we look at it in those terms, we stood up a special group that has the governance role, but it has a certain expertise around the legal aspects of a hospital system, researchers, so there are physicians that do research on that committee that bring a closer view of the reality of the research world, but at the same time recognize that they have this duty for the organization to be stewards of our data, and therefore produce a review that is tailored to that scenario, enabling it to have that same type of innovative and non-stifling experience, but at the same time protects the organization and our data asset.
Nice. Yeah, I love the example is that balance between enabling some innovative research that moves something forward, whatever the research is, but also respects the right controls and guardrails that are in place, so the data that needs to be used and has rules around how it can and can't be used, and opt in from the people that provided it, and all those good things. Brilliant. I also, just to kind of finish off, I'd love to talk to you about, given that we're still pandemic, and I'm sure talking about it for a long time, just to kind of get an idea of how that's been for you and the organization during the last couple of years, and how data's played a part in sort of managing and responding and reacting to this sort of ever-changing sort of COVID situation. It'd be great just to kind of finish off with some stories there, if you're able to.
Yeah, and I as I start to talk about data, I don't want to at all lessen the impact that the frontline workers have made to this whole situation. I mean, I can't for a second say that data overshadowed the fact that the nurses and the doctors and the janitorial staff and everyone keeping our hospitals open and functioning during this time played such a key role. In response to the pandemic, and how we tried to address the needs we saw in the communities, whether it be initially with analyzing the trends of admissions and capacity, data was driving a lot of those decisions. Looking at, here in Pennsylvania, our state, mandated that non-essential elective surgeries be stopped, which are a huge revenue generator for hospitals. And so looking at what that meant from a tough time, we used our insight into that to pivot on projects to say, okay, we had, for instance, those telemedicine and tele-ICU and other options for delivery of healthcare or observation of health status change, and we move those up in the queue to address the overarching need that was existing there. Again, that was somewhat obvious, some people would say, but I also think it was data driven, looking at it in terms of, where are the needs? How is this impacting? And, is it impacting certain counties and certain communities differently? Secondarily, it impacted our approach to testing and how we rolled out testing to the communities and saying, can we track this? How can we observe the trends and what's actually happening and the different populations and what COVID actually did to those different populations, whether it be age-based or disease condition-based. And then finally, it had a huge impact in how we rolled out our vaccination program. Right. And specifically here in Pittsburgh, we had a lot of focus on these massive vaccination clinics where we used our Major League Baseball stadium to host a clinic, and we were putting through upwards of 4,000 people in a day, using data to identify the key population, starting with the elderly population, those at high risk, moving through that, and then expanding it and using other corporate facilities that were large enough to handle crowds of up to 6,000 people getting a vaccine in a single day. Mm. How do we pull our resources and our own staff? For instance, I have a background as an EMT. I'm no longer certified as an EMT, but I continue to maintain a first aid certification as part of my responsibilities through judo. I maintain this first aid first responder type of certification, and that enabled me to volunteer to serve with these clinics, even though I have a desk job, right? I don't necessarily, I'm not patient facing. I was able to go and help our nurses and other clinicians deliver the vaccine by observing patients for the 15 minutes after they get the shot. You need people to do that. If you don't have enough people, you can't give enough shots. And so leveraging HR analytics to get the people with those certifications so that we could staff those clinics, finding the populations, and then recognizing that, the diverse community that we have in Pittsburgh, not everybody can go to these massive clinics. There was some hesitancy in different communities. So we started targeting senior centers and community centers and churches and partnering with them to roll out the vaccine and do smaller clinics that served maybe 1,000 people or 500 people. And, again, staffing those appropriately with the various mix of individuals. But again, in each of those scenarios, contacting people who hadn't had the shot, were in the specific category that we were targeting, all data focused, all driven by data, built through analytics to deliver on making those events successful. And I don't have these numbers with me. Obviously, it's not actually my job to know these numbers, but we consistently delivered the number of vaccines that we anticipated taking.
Right.
We weren't having like leftover, and we were using Pfizer for most of these. So the Pfizer one is the one that needs that high refrigeration and whatnot in preparation phase. So it was very important for us to do all of that
demand management, stock management and logistics side.
Absolutely.
Yeah. Fantastic. Well, I've talked to quite a lot of people about how their organizations reacted and responded to COVID, and I'm continually astounded but mightily pleased at how quickly things can happen when they need to, and how much data can play a part in enabling that pace, and tracking and checking the right things have been done sort of retrospectively as well, so that you can continually improve. And amazing job. And the fact that you could roll up your sleeves, hands-on, support the front line as well is brilliant. So bravo to you, and I'm sure that's gone really well. So listen, really good to have you on the show. Thanks a lot for helping to sort of tell your story and unpick how you see data governance. I love your lens on it and the way you talk about it. So sort of proactively and in an enabling way, if I can say that right. So thank you very much for coming on the show, Anthony.
Absolutely, Jason. It's been a pleasure.
And thanks everyone for listening. We hope you enjoyed that great run through of data governance with a slightly different feel to it, as many may have heard of it before. So thanks everyone. I hope you enjoyed it, and we'll catch you again soon.